Here are some frequently asked questions about dental emergency house call visits. We get calls all the time about dental emergencies. Let's talk about the different types of dental emergencies we often get. The first and most common type of dental emergency is that a crown or bridge has suddenly fallen out. Is this a dental emergency? Well, the answer to that is it depends. We need to see a picture of the inside and outside of the crown or bridge. And what we're going to be checking for is to see if there's a post, which looks like a sharp piece of metal attached inside of the crown or the bridge. If we see that, great news, because that means that a root canal has been done and there's less of a chance for there to be any infection or pain to occur. And if the patient's very old and frail or on hospice, we leave the asymptomatic root alone in the mouth unless they have pain. Swelling means that there is always an infection and an extraction should follow. Meds should be checked, especially if they're on blood thinners or aspirins, and we always look to see if they're on Xgeva. We call the physician to see if they feel it could be safely done at home. We try to take an x-ray, but if the patient can't cooperate, and that sometimes is the case due to the dementia, we'll ask for an old x-ray to be used. That's why it's on the new patient form. If there is stubs left in the mouth, the good news is you can recement it. You want to do that as soon as possible because we don't want the tongue or the cheek to get cut, and it's difficult to chew without your bridge. Sometimes there's difficulty in scheduling. If that happens, it's not a big deal. It's not a real emergency. But the most important thing is to have the caregiver take a great picture of the inside and the outside of the mouth and inside and outside of the crown so that we know what tools and supplies to bring. Another emergency that is reported often is swelling. Now, this is a real emergency and not one to be taken lightly. If the face is red, the neck is red, the eye is swollen, the lips are swollen, most likely you're going to need to call 911 immediately and tell them it's a tooth infection so that when the ambulance comes, they can take you to the closest hospital with either an oral surgery or a dental residency department. Any toothache is definitely a dental emergency. An x-ray should be taken and then a diagnosis can occur immediately. If the patient can't tolerate treatment and it is an emergency, we may suggest sedation dentistry as this is the safest and it can't be done in the home. Toothaches are painful and sometimes you just need a sedative solution and that can be an immediate relief. Loose teeth, that's always an emergency and that can usually be done safely at home. Another emergency is a broken denture. And yes, this is an emergency because you can't speak or smile and that's embarrassing, you can't chew. Never, ever attempt to repair this at home, or a dental lab will not touch it after that. It'll take 1 to 5 days depending on the lab schedule and the dentist's schedule, but it's an easy fix. And if a tooth breaks off the denture, no big deal. We can have that fixed as well. And if you lose the denture tooth, no big deal either. Do not do it with a self-repair kit. You didn't go to dental school. If a clasp on your partial denture breaks, this can be repaired as well. It's not such a dire emergency, but the clasps do hold the partials firmly in place and can be repaired either by soldering or adding a clasp along with acrylic. Don't try to do this at home. Losing a denture is an awful emergency and one that we hear about every single day. Alzheimer's and dementia patients are at risk and extra care should occur after meals and at bedtime. Never wrap them in a napkin because this is one step away from the garbage can and they're rarely found. So if they have dementia, watch their every step. Always remember to take the dentures and leave them at home, take them out if you're being transported in an ambulance. Ambulance's job is to make sure your airway is clear and they're going to remove a prosthesis and who knows what happens to them after that. They're not responsible and it's an awful loss when it happens and it happens every day. So my suggestion is if you have Alzheimer's or dementia and you're the caregiver, always remove the dentures and store them safely at home before they go to the hospital. Hospitals lose dentures too, and it's a difficult process dealing with them to replace them. They never want to take responsibility and it's a horrible emergency. So always leave your dentures safely at home. Maybe even leave a note on the door, take out dentures before going to a hospital. Another example of an emergency is a cracked tooth. So if you do have a painful tooth, this is an emergency. If it's sharp, that is an emergency. If it isn't sharp or painful, then you can put it off a few days, but you should get an appointment. Gum pain should be checked when painful. And the solution may be as simple as a deep cleaning or maybe changing the oral care products you use. Only the dentist can diagnose this effectively, and we will treat this emergency. Don't put it off and make the appointment as soon as possible. Emergencies that can wait are tooth sensitivity or a filling that's loose or chipped. If it isn't sharp, it can wait a week or so, but never put anything off. So let's recap in order of importance. Swelling of the neck, eye, cheek, or lips is definitely a huge emergency, and you should call 911. Anything that's sharp or painful should be seen as soon as possible. Broken dentures or broken partials or broken clasps, these should be sent to the lab as early in the morning as possible so you get them back as soon as possible. Don't wait if a filling's cracked or loose. It may not be an emergency now, but get it seen as soon as possible so that it does not become a huge emergency. That makes sense, right? Here at Geriatric House Call Dentistry, all of our providers are here to answer your questions, and we're happy to advise you and to keep you and your loved ones pain and infection free. That's our number one thing. A healthy mouth is the most important aspect to have overall clean and healthy systemic health and longevity.